welcome to our carers course. My name's Emily, I'm a dementia support worker for St Giles Hospice.
My name's Pat and I'm from Pathways for Life.
And our normal role is working with care homes in Walsall, helping them to support with their residents who have dementia, helping them to understand their residents and best practice. However, what we're going to do with you today is we are going to run a carers course for yourselves. So, a little bit of background about ourselves. I've worked professionally with people with dementia for 8 years, and I'm also a family carer for family members with dementia.
And I've worked in care services for around 35 years, working with people with dementia in care settings.
So how this course will run, in this first section we're going to talk about looking after yourself. So we're going to be talking about you, the carer, and things that you can do to look after yourself, and a little bit about dementia as well. In the second section, we're going to look at nutrition and hydration, why that's important for people with dementia, and also infections and the impact that that can have on people. In the third section, we're going to look at dementia-related behaviours, so why the person you're looking after might be behaving the way they are, and things that you can do to help them. In the fourth section, we're going to be looking at planning for the future, and talking about all those things that you can put in place now to support for the future. So what I'm going to describe to you now is something that's called the bookcase analogy. So this is quite a helpful way to get your head around how dementia might affect somebody. I want you to imagine that I'm 80 years old, and beside me here is my bookcase. This bookcase is my life, and every book on here is a memory. So the books on these top shelves, these are my most recent memories, so maybe what I've had for breakfast that morning. The books on these shelves are my memories from my 60s, so maybe when I retired. The books down here are the ones from my 20s, maybe from when I got married. And these books right down at the bottom, these are all from my childhood, so memories of going to school. And dementia, when it comes along, it causes my bookcase to rock. And these books will start to fly off, beginning with the ones on these upper shelves. So as these shelves begin to empty, what I think of as my most recent memories are actually from an earlier period in my life. I want you to imagine that these top two shelves have emptied. The ones I'm left with are the books down here, the ones from my 20s. So to me, my reality right now is it is the 1950s. So if that is my reality, I'm going to be doing whatever I was doing in the 1950s, routines that I had in place at that time. So if that involved putting a kettle on the hob, that might be a behaviour that I go back to. Or I might be looking for whoever was around at that time. So I might be looking for someone, a family member who was also in their 20s at that time, which might be why I don't recognise an older family member for who they are now. For example, my husband. If my husband is the same age as me now, 80 years old, I might not recognise him because I'm looking for somebody in their 20s. And I might not recognise my children because I don't recognise them as adults. I might be looking for little children that are down here. So from what I've said so far, you might think that my bookcase over here is going to be empty and I'm going to be left with nothing. But I've only told you about one side of the brain. So this bookcase is your factual memories for people, for places, dates, and it's your hippocampus. It's not very resistant to dementia. But over here there's another one, and it's your emotional bookcase that is much more resistant to dementia. So my emotions will still persevere even if the memory has gone. So, for example, if we have an argument, I'm going to be feeling upset, I'm going to be feeling angry, and that memory might disappear from this side, but the emotion will still be there. And likewise, if we go out and we have a nice day and we have a really good time, I'll be feeling happy. And the memory might go from here, so I'll forget that we've been out, but that emotion will still continue. And I'll still be feeling happy, even if I might not remember what you've done for me that day. Hi everyone, and welcome to our first section. Our aims and objectives for this section are to understand the different types of dementia and how dementia may progress, to understand the importance of looking after yourself when looking after somebody with dementia, and to learn about the local support available in Walsall. So, we're going to talk now about the different types of dementia. Do you know what the difference is between dementia and Alzheimer's? So dementia, the word dementia is just a description for a collection of symptoms. So imagine that that's up here. It is our umbrella term, and under this term come lots of different subtypes of dementia. So Alzheimer's is one type of dementia. It's our most common type in the UK. And it's followed by another type called vascular dementia. And then there are rarer types like frontal temporal, posterior cortical atrophy, and Lewy body dementia. There's actually over 100 different types of dementia, but the ones you're most likely to come across are Alzheimer's or vascular type dementia. You can also get a mixed type dementia. It's usually a mixture of Alzheimer's disease and vascular dementia, but there can be other combinations as well. Alzheimer's disease is caused by plaques in the brain. So like you get plaque on your teeth, you also get plaques in your brain, plaques and tangles, and these stop the brain cells from communicating with each other, and it leads to a medical term called atrophy. That just means that the brain shrinks on itself. All of our brains shrink anyway as we get older, but for people with Alzheimer's disease, it shrinks more than we would expect for that individual, and then that causes the difficulties that we see with Alzheimer's. It's also what we call a global condition, which means it affects the whole of the brain. Vascular type dementia is slightly different. It's caused by the circulatory system. So cells need oxygen to function, and when they don't get oxygen, they die off. Vascular dementia, whatever's causing that, if it's something like heart failure, high blood pressure, cholesterol, diabetes, if that affects how the blood circulates around the brain, that can lead to cell damage over time. So unlike Alzheimer's disease, which affects the entirety of the brain, this might be vascular dementia may affect certain parts of the brain depending on where the blood is not getting around so effectively. So now we're going to talk about dementia progression. All types of dementia are progressive, which means that over time that person will gradually get worse. However, everybody is unique with their dementia. So each person will go through their journey differently, and they will progress at different rates and have different symptoms compared to other people. Even if you have two people with the same diagnosis and the same age and the same other health conditions, they will still present differently with their dementia. But in general, dementia can cause issues with perception, time orientation, continence, mobility, and language. There are different stages available online. However, just be careful if you look at these, because not everybody moves through the stages fluidly. If you do look at them, you may find that your person, if you're thinking about your individual, will have symptoms of all of those stages. But they're useful as a guide to what to expect in the future. As a general guide, Alzheimer's disease tends to have a slow decline over time, so that person will gradually go downhill as time progresses. Vascular type dementia has a stepwise progression, so that person will be relatively stable, then they will dip, then they'll be stable again, and then they will dip again, but they won't go back up to where they were before. The other common factor with that vascular type dementia is that people say they have good and bad days. Again, this is to do with the circulatory system. So let's say it's the heart failure that's causing the vascular type dementia. If the heart is working well that day, that person will function very well. However, if the heart is compromised that day and they're not functioning so well, the blood's not getting around the brain as it should, that will be when the person's difficulties become more pronounced and they'll struggle a bit more. However, even though we have different stages of dementia, it can be very, very difficult to predict exactly how somebody is going to present with their dementia. With other conditions, it's easier to say when they get to a certain point, this is what we expect to happen next. But that's really hard with dementia because everybody is so unique. So it would be very difficult to predict exactly what skills will be affected in the person you're caring for and length of time with dementia. Some people can live with dementia for a very long time, and other people it's a rapid decline. It might be helpful to think of dementia in terms of snowflakes. Each snowflake is unique because it takes a different path through the clouds to get to the earth, and that's how it's shaped. And people are exactly the same. They've all had different walks through life to get to where they are now, and that is why individuals with dementia will present differently to each other. There are lots of challenges faced by carers looking after somebody with dementia. It's a very, very difficult job to do. But in general, it can be things like finding the appropriate support to look after that individual at home, recognising pain, especially as dementia progresses, if it affects their language ability, and understanding if your individual that you're caring for is in pain, managing sleep changes. Again, as dementia progresses, somebody's sleep pattern may be disturbed, and that can be very tough on carers if they're being kept up at night. Coping with and understanding dementia-related behaviours. This can be quite difficult as well, understanding why the person you're caring for is behaving in the manner that they are, and how best to cope with that and support that. And carer guilt. This is absolutely huge for people, because carers want to go that extra mile because they care about the person that they're looking after, and sometimes even though they know they are doing enough and it's right, this can still cause them to feel guilty, feeling I should be doing more, I should be helping out more, there's something else I could be doing. It's a massive burden to carry around, and this is very, very common in lots of carers. And having a break, this is also a big problem for carers. Trying to find time for yourself, which is very important to do. So some tips to cope with the challenges that I've just mentioned. Seek support around you. There are day centres available for people with dementia and their carers to go along to. Carer support groups and paid carers as well to come in and relieve you and give you a break. Register as a carer with the GP. Make sure that that is listed on your profile with your own GP, so that they can check that you're okay and make sure that you get appointments that you need to enable you to carry on caring for that individual. Register consent forms with the relevant people. It might be worth registering a consent form with your person's GP to enable you to talk on their behalf. It might also be helpful to register this with utility companies, and they may have their own consent forms, so double check what they actually need, because if they call the person at home, they may need to speak to them rather than yourself, so make sure you've got that consent in place. It might also be helpful to give your individual emergency contact details to carry. So if they go out and they wear a certain coat, or they take a purse or a bag with them, it might be helpful to put your contact details into their coat or their purse and their bag, so if they get into difficulty while they're out and about and somebody stops to help them, the person who has stopped knows who they can contact to come and help with that individual. And it may also be worth asking for moving and handling training for yourself and your individual, so that you can work together in how to support them. What we don't want is for you to become injured when you're trying to support your individual.
Okay, we're going to look at benefits now. There's a benefit called attendance allowance, which is means tested, and this helps if you've got to take your loved one on journeys, so it helps to pay for petrol to go on different journeys. There's many benefits that you may be able to claim that you'd have to go online to find out about. But if you see your GP, you can discuss the severe mental impairment benefit, which may help you to get a reduction in council tax. Now we're going to look at lasting power of attorney now, and this comes in two parts, one for finance and one for health. It's really important to get these in place while the person's able to give consent to do them, because once the person's lost capacity, you can't do a power of attorney. I'm going to talk about carers' guilt and respite now. It's really important that you have a break and be honest with yourself. Caring for someone is really, really difficult. And always think it's not a job that you signed up to do, and it's a very difficult job that you do. Do some research, look at care homes and look at respite. We'll talk about care homes more in week 4. Local support is available, and you can go to the Alzheimer's Society There's a Linkline Carers group, Dementia Caps, Cognitive Stimulation Therapy and Age Matters. And if you see the link below for all of these services. Okay, we're going to look at assistive technology now and the environment. So these are things that you can do for your loved one. Maybe using coloured plates can be really helpful to a person with dementia, because people are unable to see white plates, so it's really good to use coloured plates to enable them to have a better meal experience. You can also look at having a key safe at the front door, and this can make it easier for your loved ones if they've got external carers or they're unable to come to the door to let anyone in. You can also look and do fall spells if your person's at risk of falling, and this will alert someone should your person fall. You can have Amy pendants that people can wear around the neck or the wrist, and this, if they fall or they're unwell, they can call for help. We can also use door sensors which will tell you if your person is going through the front door. Bed sensors, so if your person gets out of bed, and it can be timed so they can use the bathroom, and then it will alert you if they haven't come back to bed. So there's lots of things that can be found for assistive technology, and you can use coloured toilet seats as well, which make it better for your person to be able to use the toilet. Daily living skills are really important for people, and this can involve laying tables, washing up, folding the washing, peeling the veg. It's really important for the person's well-being to be involved with daily living skills, and it doesn't matter if this isn't done perfect. It's really important that we keep our loved ones active by doing daily living skills. It's sometimes easy to want to do everything for a person, but then we de-skill them, so we need to keep them happy, active and independent for as long as possible. Music's really important to people with dementia, because if you think of yourselves, if you hear songs and music, that brings memories to yourself, and that's exactly the same with our loved ones with dementia. We recognise music from a very young age, and if we go back to what Emily said regarding the bookcase, it's first in, last out.
I'm going to show you a simple hand massage that you can do at home with the person you're caring for. So first of all, it's important to have some lotion that you can rub onto them. This is important because if you're working with somebody who's an older person and they have very thin skin, we don't want to give them a skin tear. And also make sure that they're not allergic to it as well. So you don't need lots, you only need a little bit. So just to begin, just pass it between your hands. You're not rubbing it into your own hands, you're just making sure that your hands are covered. Then likewise, you pass it onto your person's hand. This is again just to stop any skin tears. So to begin, just by rubbing figures of 8 on the back of the individual's hand. And then do little raindrops on the back of their hand. And then draw down each finger. The idea with massage is that you always draw away from the body to draw out the negative energy. And then lastly, cup the person's hand and draw down. And that's a very simple massage that you can give, and you can use any of those steps in any order or make your own. There's no rules with massage, and there's plenty of videos available on YouTube if you want some more inspiration.